Late Night Health continues. I'm Mark Allen. At the end of this hour, Robert Clancy, the author of Soul Ciphers, will be joining us, and we'll be talking about respect. And we'll find out his inspirations about respect coming up here on Late Night Health. You can always join us at latenighthealth.com and at facebook.com/Late Night Health Radio. Our next guest is Arnedra Jordan, and she is the community resource advocate for the Susan G. Komen Foundation in Los Angeles. And we welcome you to Late Night Health, Arnedra.
Thank you. Thank you for having me, Mark. Thank you.
We know that, first of all, next month, in just a couple of weeks, is the African American History Month, and we'll be celebrating the impact that the African American community has had on our on America, as well as, I just saw a great interview with David Letterman and President Obama the other day. It was magnificent what this man has done to move the country forward. But I go off into political science stuff right there, and you are an adjunct professor of in the Los Angeles area.
Yes. Let's
talk about the statistics of African American women and breast cancer versus the Caucasian community. It's significantly higher. Do we know why?
Yes, because African American women tend to get diagnosed at a later stage. Also, when we look at resources, when we look at the hospitals in LA County and where African American women live, they tend to have to use public hospitals, and public hospitals have a longer wait. So sometimes women have to wait 6 months to get a mammogram, or 6 months to get their surgery, or 6 months to get follow-up resources, so they're being diagnosed in a later stage. And that's what we're trying to do, is stop women from being diagnosed in a later stage.
Is that because of financial concerns, or is that because women African American women just don't have the resource or the understanding?
It's a little of both. So a lot of women, we surveyed women and we asked them, some of them said that they didn't want to know. Like, if it's I don't have any symptoms, my mother, it's not in my family. So we're trying to change people's mindset that breast cancer does not have to be running your family for you to get breast cancer. It's your genetic makeup, And so we're talking to women. Women think that, my doctor said I don't need a mammogram. Being an advocate for yourself and saying you do need a mammogram. At 40 years old, get a mammogram.
Absolutely.
Yeah.
Or there are other technologies, medical. I'm trying to think of the term, imaging.
Yes, imaging. Yes,
and
thermographical imaging.
Yes, exactly. Yes. Which is not typically covered by insurance.
Correct.
But it's just something else that women can use. You are a part of the Circle of Promise. It's a California initiative. What is it? What is the Circle of Promise?
So for Circle of Promise in California, it's an initiative across the state in 7 cities. I work for LA County. So in LA County, we've been charged with the task of making sure that women not only get in there to get their mammograms, but return the next year. So also what we find out is that women get their mammogram, say at 40, then they wait 6 years. So in 6 years, things could have changed. So getting women to change the way they think about their health and actually facing their health. And at 40, getting a mammogram and then doing it the exact same date the next year. 41, getting a mammogram, and talking to other women and getting other women, like their sisters, their mothers, their cousins, to go with them to these mammogram appointments, and not just getting your mammogram, but following up with the doctor. and asking the doctor for your results and asking the doctor to explain the results and, just being an advocate for yourself. And so up to this date, we've provided over 3,500 free mammograms in the community of Los Angeles, but we still want women. We don't just want to provide free mammograms. We want to give you the resources and the tools that you need to progress in life. And so if we have women talk about their health, they'll be healthier. And most women tell me, well, I have two small children. I need to talk to, I don't have a babysitter. But if you get breast cancer and it's diagnosed at a later stage, you won't be here for those young children. So just getting women to change the mindset.
I didn't realize that you should have a mammogram every year.
Yes, we tell women every year, and the reason why we tell women every year is because things change. I have had people who have went in November and then in February found a lump. And in November, their mammogram was all clear. So we say every year, and we also tell you to ask for your film. So that way, if you change doctors, if so the medical, whatever happens, you have your film, and the doctor can look at the film and see if there's something different than the year before if you decide you want to change doctors. So you always keep your film. And
you can always have that stored digitally, too.
Yes. You can have it stored digitally, but I always tell women, what if you move out of state and they can't get it or whatever? Ask them to put it on a CD and take it home with you.
Gotcha.
And keep it.
And I know people who put it on their iPads, their phones, and all that. Look, I'm clean. That's good.
And keep it with you. Yeah.
Yeah, exactly. How is the program working? Is it reaching women, and is it getting women to take care of themselves?
Yes. So we have we've done a significant impact in the community. Actually, today we had our community partnership meeting, and I'm excited to say that we partner with LA Care. So what we're trying to do is get women to take care of their whole body, not just their breast, because you have to take care of other parts. If you're not mentally stable, or if you're sick with diabetes, then this is going to help. These are onsets, that can make the cancer progress. So we're getting women to talk about their health, and we actually had 15 community partners show up today for a 9 to 10 o'clock meeting, and we talked about how we're going to change women's health. So it's working. We get the emails, we get the cards. We like to go back and do our mammograms in the same place because we do mobile mammography, so we come to you. So you can walk to your church or walk to the grocery store and get your mammogram. So women now wait.
And it doesn't take that long either.
No, it's 15 minutes, and we can schedule an appointment. And if people are older or they tell me, I have to take my kids out, I'll say we'll take you first thing in the morning. Be out here at 8:30. We will take you first, and we take them first. We know people have to work. We know people can't get off work or they might lose a day of pay. So we try to work with you, and I always try to make sure all the mobile mammography events are in the community where women can walk to them. And not only that, we're lucky enough to partner with Watts Health Corporation, where if there's something wrong with your results, they will go to your house and pick you up and take you to the center and take you back home.
Wow.
So we're trying to make it where you have no excuse to get your mammogram. We have survivors out there who will talk to you about a mammogram. We have women out there who can tell you what a mammogram is like. So there's no excuse not to get the mammogram.
Is the Circle of Promise geared primarily to the African American community, or is that open to everybody?
It's primarily for African American women, but it's open for everyone. Like, we have a support group, and our support group, we saw some Latino women who wanted to join, so we got someone to speak Spanish because we're about saving lives. We are focused on African American women. We are looking at the data and the numbers in the African American community because it's a crisis when we look at the African American community. However, it's open to anyone. Everyone's welcome. Everyone's welcome.
Which is terrific. Our guest is the community resource advocate for the Susan G. Komen Foundation in Los Angeles, and her name is Arnedra Jordan, and she's out in the community all the time. Do you actually go out to the mobile mammography units?
Yes, I'm at every mobile mammography event. There is a few that I do have to miss because of other obligations we have. But if I'm not there, we always have two survivors on staff. Jackie Coco usually goes out, Helen Starks, and we have interns who have been trained by us, and we also make sure that we have someone who speaks Spanish so that no one's turned away from the truck or no one doesn't understand what's going on at the mammogram truck. So if I'm not there, there's a team of staff members and volunteers who are well equipped to help you.
Are women apt to get the mammogram and then not follow up with the results? I mean, in general, doctors say if here's a bunch of tests and if you don't hear from us, you're okay, which I find horrific.
Yes, me too. So what happens is they get their letter in the mail, and I have some, they get a letter in the mail. So if there's something wrong, they get a call within 3 days. If there's nothing wrong, they get a letter in the mail that says, congratulations, we found nothing wrong. Come back next year for your appointment. But when I tell women, call me when you get that letter. Let me know if you need me to help you go over the letter. Let me know if you have any questions. Let me know if I need to forward you to a advocate, like a patient navigator or resource, if you don't understand it. If you are okay with just having the letter, then fine. But if you need some help, some more explanation, just give me a call and we'll walk through it. And I have had some people who have called me and said, I'm really not understanding this letter. I got this letter, and I walk through it with them.
And the percentage out of every 100 African American women who have a mammogram, what is the percentage of breast cancer that's found?
So it's about 2 out of 100, but we're also looking at in LA County, so it's only 11%. So that's high for African American women because it's only 11% of us.
Wow,
that's very, very high.
That really is.
Yeah.
And for the rest of the population, do you know what those stats
are? It's 1 out of 8 for the rest of the population. So 1 out of every 8 women will be diagnosed with breast cancer in their lifetime. But for African American women, even though we're less likely to be diagnosed with breast cancer, we're more likely to have an aggressive breast cancer, and we're more likely to be diagnosed at a later stage.
Which means it could metastasize and spread throughout the body.
Which means it might have already metastasized, which means more treatment, or losing body parts,
Wow.
Yeah.
Insidious, to say the least. If people are interested, where should they go to find out more information about the Susan G. Komen Foundation LA chapter, as well as the Circle of Promise?
Okay, so if you want to Komen LA County, it's www.komenlacounty.org/COP. And there you'll find my name, my number. You'll even see my picture. And
a pretty picture it is as well.
Thank you. And then LA County, or if you just want more information about Komen LA County, you just put in www.komenlacounty.org and you'll see Komen right there.
Terrific. Listen, we appreciate your joining us here on Late Night Health. She is the community resource advocate for Susan G. Komen in Los Angeles. All right, coming up next, we've got Robert Clancy. We're going to be talking about respect as Late Night Health continues. Join us at latenighthealth.com.
Thank you.
You're welcome. Thank you.
All right.
You're listening to Late Night Health with Mark Alyn. The show continues in a moment.
Welcome to Guide to the Soul. This is Robert Clancy. Opening your heart is the only way to allow all the light in. Unconditional love does exist, but it takes trust, something not a lot of people are willing to give. But how can you expect it if you don't provide it too? All hearts are refillable, rechargeable, and renewable. So why worry about being burned? By giving, you have everything to gain. Think of how beautiful your life would be if someone loved you without barriers, gave all of their heart to you without conditions, and wrapped their soul around you like it was your last day on earth. Today, you can be that person for someone else.
For more inspiration from Robert Clancy, visit guidetothesoul.com or go to the Moments with Robert page on latenighthealth.com.
If you or someone you love suffers from drug addiction, now is the time to utilize your private health insurance PPO plan. If eligible, receive up to $30,000 or more in substance abuse benefits with low or no out-of-pocket cost. We are the National Treatment Network, the premier drug and alcohol treatment referral service operating 24/7. We help connect you with facilities nationwide that accepts PPO private health insurance for substance abuse. If you have PPO substance abuse coverage and you need immediate admittance to a medical detox or residential rehab treatment center, call us now. Call our live referral helpline today. The call is free. This program is not available to Medicare or Medicaid customers.
Call 800-296-1252. 800-296-1252. 800-296-1252. That's 800-296-1252.